Hello everyone, my name is Sharon Dayes and I'm the Patient Experience Specialist for Energesse, and welcome to our webinar, How to Translate Patient Surveys into Improvements and Outcomes. Just as a reminder, we're going to be using GoToMeeting for this webinar, and your microphones will be put on mute just to make sure that they are all on mute while the presentation is ongoing. We're going to have some poll questions during the webinar, so please type your responses to those questions into the chat box in the GoToMeeting control panel. And just as a reminder, we'll have plenty of time at the end for any additional questions, so if you could into the chat box as well, Dr. Avi can address those at the end of the webinar. So I'd like to introduce our presenter for today, Dr. Avi Ratnanason. He's the founder and CEO of Energesse, a firm that specialises in improving the patient experience and customer experience in healthcare through consulting, training and survey services. Please welcome Dr. Avi.
Thank you very much, Sharon, and welcome everyone to the Patient Experience Masterclass today. As Sharon mentioned, my name is Dr. Avi Ratnanason. I'm the founder and CEO of Energesse. And really, I'd like to get straight into the webinar today to add as much value to you as possible in today's session. We're going to go for a little under an hour, so sort of 45 to 50 minutes, and allow time for questions at the end. But I do want to try and make this a little bit interactive. So I'll be asking you questions along the way as well, which you can type into the chat box on the right. And we'll aim to answer them either during the webinar or ideally at the end. So today's webinar, or masterclass rather, is around how do we translate patient surveys into improvement and outcomes. And you know, this is really a topic that's, well, very topical. I get this question a lot. Oops, someone has just managed to get onto the video screen somehow. If I could just turn that off and turn off the webcam, we'll just get back into the presentation. Not quite sure how that happened. So really, while my team's working on that, what we'd like to do is really get into how do you actually translate surveys into survey outcomes, and how do you actually create improvement. So the learning objectives really is for some people are still in very early stages of patient experience improvement. They're actually trying to measure the patient experience. It can be quite a confusing space. There's lots of survey tools, methodologies, and questionnaires out there. Others are a bit more advanced. They're already delivering good patient experiences. They've had improvement programs in place. They've stepped up the improvement and outcomes in terms of their patient experience maturity, and they're really trying to scale. They're really trying to actually generate greater improvements, scale improvements, get better engagement, engage leaders, or even other partner organizations in their patient experience initiatives. I've recently had meetings with people from the ministries of health, health ministers, and discussing patient experience even at a state or national level and what that's going to involve. So really, I think some of you are going to be at very different stages, but I'm going to try and deliver a presentation that gives you at least one action that you can apply coming out of today's session. So at least one action that you can take away, that you can apply in your own organization, health system, team, or ward, or clinic, coming out of today's presentation. So feel free to take notes along the way. We will record this presentation and allow you to sort of move on from there as well. I am having a couple of issues with PowerPoint, so we'll try and overcome that. So really, just in terms of the where we would like to go from today, we're going to talk a little bit about how to measure patient experience with more effective surveys. We're going to talk about how you have a strategy and an improvement methodology, because all of this is critical. We're also going to talk about how to champion culture change, because that's a big part of engaging people into the improvement process. And finally, we will also talk about how to actually use the right tools and solutions that fit the resources and maturity stage of your organization. This is really important because we're all at different maturity stages, and we don't actually realize that your organization or your team is at a different maturity stage in terms of the patient experience. So whilst we're sort of going into that, I'd just like to ask you a quick question. What is your main role in the patient experience? What's your role title or job function? Or how do you see yourself being involved in patient experience? If you'd like to type that into the chat box on the right, that would be very helpful, because it will just give me a bit more context of who's in the room, what roles you play, and how I tailor the rest of the presentation today. So go ahead and do that, and we'll go from there. So as people are typing it in, a little bit about our background at Energesse. Well, we really work on transforming the patient experience, and we do our work around the world, but also across different silos or sectors of healthcare. So we've worked with some of the largest hospitals and health networks. So Western Sydney Local Health District, Southwest Sydney Local Health District. These are some of the biggest health districts in New South Wales, which include Westmead Hospital and Liverpool Hospital, some of the largest hospitals in New South Wales are clients of ours. We've worked with Ramsay, Baton Rouge in the US. Our partners have worked with some of the hospitals in the NHS. We work with the specialist clinics like Genea in fertility, and we work with the private health networks like Eastern Melbourne. We're also partners of Apple. We're on their Apple Consultants Network, and really work on patient experience in the digital space quite strongly. We worked with the research sector, such as CSIRO, Health and Biosecurity, as well as the Australian Academy of Health and Medical Sciences. We've also worked with recruitment firms, because as you know, the research experience as well as the recruitment experience of staff is very important, because there's correlations between staff experience and patient experience. We've even worked with industry bodies like AHHA, where I've sat on the council for several years, and I've also worked with the private health insurance sector, NIB, Bupa, Medibank, GU Health, and so on. So we really worked across the health sector, both here. We've also worked in other countries. We've done projects, as I said, in the US, partners in the UK. We're doing work in Malaysia with one of the largest hospital groups in Malaysia, KPJ Group as well, and running some training there. So we really got very diverse experience around implementing, measuring, and translating surveys into better outcomes. And I'd love to share that knowledge with you in today's session. So what do we actually do? Well, a number of things that we do. So we actually implement patient surveys, PREMs, as you call them, patient reported experience measures, help clients customize surveys. We also do patient and provider journey mapping. We analyze data and reporting on patient surveys. We also have done research projects in this space. On an engagement front, we've helped with personal development programs, leadership engagement, change engagement, frontline staff training, customer service, as well as keynotes in hospitals and at conferences. In terms of how do you implement solutions, we've actually helped organizations with this strategic change in management, coaching on implementation and consulting in this space, as well as training on communication skills. In terms of excellence and benchmarking, we've helped organizations with realizing their outcomes from the technology programs or other implementation programs, evaluating them, build communities of patient experience, which I'll talk about, and very, very much so these days, more and more organizations are starting to look at how do we map our maturity using a maturity model and evaluate the maturity so that they pick the right solutions to translate survey feedback or other sort of interview data into outcomes. So as you can see, our services have expanded to be quite an integrated approach to patient experience, and we find that different organizations are needing different solutions or different help at different times. You're probably finding this yourself. So one thing that's very important is first to figure out what are your objectives in terms of where you want to be in patient experience and what you want to achieve, you may be aware that health systems are moving into this path of the healthcare triple aims or the healthcare quadruple aims. And the healthcare triple aims was really coined by the Institute of Healthcare Improvement, that really stated that health systems are moving in a direction of improving patient experience, improving the health outcomes or clinical outcomes of patients, as well as improving value. And value is defined by either improving revenue or reducing cost per capita, as health systems are really trying to become more efficient. More and more people are, in basic terms, becoming sicker, living longer, and health systems are trying to cope with that burden of more and more people coming through the system. So how do we deliver better patient experience and outcomes while at the same time controlling the costs? And for the private sector, I'm seeing the need to continue to grow revenue as well. But as we went through these triple aims, many organizations have also realized that you can't just do that and burn out your staff or your clinicians. So, and studies have shown that there is a correlation between the clinician experience and the staff experience, as well as the patient experience. So this is an important consideration that we take into when we're actually trying to engage staff to actually act on feedback as well. And some of the best tips have been trying to help them see this whole movement in a positive light, and trying to bring more joy and fun into the workplace as we try and improve patient experience. So there's a real opportunity here, and a key message from this slide is, that staff experience is linked to patient experience, and can you introduce or find ways to bring more fun into how we execute this as well. Now, I just want to say up front that this particular topic is a very big topic. We won't be able to cover every single choice, solution, idea in just a 45 to 50-minute session or a 1 hour masterclass. So really this is to give you an overview of what's out there, and so you can pick on or dive deeper into at a later stage with yourself and your teams. Really seem to be having a problem with the PowerPoint today, and I apologize for that. That didn't happen in the test run. But having said that, whilst we're sort of pulling that through, coming back to objectives, I think it's really important that we think about, as I said at the beginning, what is the most important outcome for you? So I find that working with many organizations, they are trying to say, Avi, we need outcomes. We need outcomes. We need better outcomes from patient experience. Well, the first thing that we have to understand is, what's the important outcome for your business, your ward, your hospital, your department? What are you actually measuring as an outcome at the moment? What are you actually measuring as a patient experience outcome at the moment? This is a key question for you. Now, public hospitals, I'll give you an example here. This is a report from the Productivity Commission on all the different outcomes that public hospitals are measuring in Australia alone. And you can see there's patient satisfaction is one of the outcomes, but it doesn't specify a specific measure. Then you have your other safety and quality performance metrics, and some of these are linked to patient experience. Waiting times in emergency, for example, is actually a patient experience measure. And then there's other safety and quality measures like adverse events, infection rates. Some of these have been shown to link with patient experience as well, and then there's cost as well. So it's really important that you understand what are the performance metrics with regards to patient experience for your organization. Some of the commonest that we've seen are scores like the Family and Friends test, used in the United Kingdom. There's measures around overall patient satisfaction or overall quality of care. These are also measures, and we've also seen measures like the Net Promoter Score, which is used very a lot in many organizations, particularly in the private sector as well. So it's really important for you to define what is the most important patient experience outcome for you. And in reviewing the evidence on patient experience, it's really important to also understand that all the research has shown that there isn't a single solution. There's no one single solution for improving patient experience. You're not going to find a one-size-fits-all solution. Different organizations are going to need different types of measures and measurement. And whilst you can have some standard questions across organizations, and many health systems are doing this, it's really important to know and find a measure that's relevant for your setting. Okay, so if you're on a ward or if you're in a clinic and so on, you can use standard measures, but one of the ways that we tend to disengage staff, or the way we disengage people from taking action, is that the measures or the survey questions that were used were not relevant to them in the first place, or the data that was coming back was not relevant to them in the first place. And so the first mistake people make is, number one, not asking the right questions, but then number two, not having the right solutions that's relevant to improve patient experience for that particular ward, unit, hospital department, or so on. And so it's the evidence shows you need different solutions for different healthcare settings. So what are some of the success factors that we found in terms of translating surveys into improvement? So I'm just going to run through a few. Now, there are many success factors, and in the interest of time, we're just going to cover a few. One of the things that I've already mentioned is you need timely, granular, and actionable surveys in terms of how you measure the patient experience. Timely, as in the feedback's got to come back quickly to the wards or to the front line if they're going to be able to take action on it. The second was you have to have granular feedback. So you've got to be able to have feedback that's relevant, ideally to an individual or to that ward. So the feedback's got to be relevant to the clinician or to the ward at a granular level, rather than saying to them, getting feedback at an overall generic hospital level and expecting people at the front line to take action on that. That's very disengaging. What's really engaging is if you have feedback that's relevant to you as an individual clinician or manager, or to a frontline staff member. And finally, that feedback has got to be actionable. So you've got to have quantitative data, but qualitative data is also really, really important. And I'll cover that in more detail in a second. Secondly, you've got to have an overall strategy for your department or your organization, and an improvement methodology that you use to improve experience. Third, there's got to be, and I hear this time and time again, we've got to change culture. We've got to change culture. We've got to energize and motivate our staff and energize that staff experience. And this is going to come to a number of things, but it's going to come to you as a change champion and a change leader. And if you are listening to this webinar, you are a change champion and you are a change leader, because you're already interested, you're already engaged, and you're obviously motivated to try and improve patient experience. And so this is going to be critical for you in terms of how you deliver that. And finally, one of the things that's really, really important is helping you and your teams implement the right actions at the right place at the right time, using the right solutions to deliver outcomes that are value-based. So obviously, the funds, the money, the budget is a critical factor in terms of some of the actions. Now, some actions like teaching people how to smile, teaching people how to introduce themselves, really don't cost a lot of money at all. And so those things are simple when you have issues around kindness and respect, when you have issues around empathy. But when you need to start investing on, say, training programs or real-time feedback technologies or digital signage to help provide better information, or email campaigns, that all requires some investment. So you've got to understand, well, what are the right solutions that I need to do to actually help engage my staff and my teams, take that feedback and translate that into outcomes. So all of these are critical success factors that you need to be aware of. There's some of the main ones, okay? There's certainly not all the success factors, but there's certainly some of the main ones that we've seen are really important. And there's many more that I can cover in other webinars, or you can ask about with questions. So I'd like to ask a question to you at the moment. What's your main challenge in terms of the, and I'll just go back a slide, in terms of number 1 to number 4, can you tell me, listing in the box here, what's your main challenge in terms of critical success factors? Which one resonates more to you? You could just put in number 1 to number 4, and it's great to see all the, I'm just scrolling through all the names, it's great to see all the people that have dialed in today to listen to this webinar. So type in there, Anne-Marie says leading culture change and energizing staff experience is probably one of the main ones. Ruth has talked about number 1, that timely feedback and also using the right tools and solutions. John Williamson has talked about 2 and 3, having that strategy and also the culture change. Deborah has talked about number 2, having the strategy. Lynn has talked about number 3, culture change. So you can see we're all at different stages, and that's perfectly okay because you know, this just shows that it, again, proves that point that at different times, different organizations have different pain points and different challenges that they need to focus on to improve, and this is perfectly okay because this is the pattern that we've seen as well. So let's get into some of the overviews of how you actually do this. Now, in terms of timely and granular survey measurement, we've done this work now for a number of years in Australia, over 3 years in Australia. We began implementing real-time patient feedback at Western Sydney Local Health District. It was about 5 hospitals in the district, or 4 major hospitals in the district, Westmead Hospital, Blacktown, Mount Druitt and Auburn. We've had very successful outcomes from the program. Now Southwest Sydney, Liverpool Hospital, and those districts are rolling out the real-time feedback platform as well. So I just want to share some of the learnings from those experiences. By no means are we saying this is the only platform. We used an MES experience, real-time patient feedback platform, but there are many platforms out there. We work with several other technologies and survey platforms for different clients and many others as well. So we're pretty platform agnostic. But one of the things that you will realize is that, and one of the things that's really important, is the importance of having the key question, right? And this key metric is dependent on the questions that you ask. So the Net Promoter Score, the recommendation question, is often how likely are you to recommend our ward or our clinic or hospital to your family or friends? And that has been a question used to determine the Net Promoter Score. Now, in healthcare, it's been adapted to the family and friends test, which is how likely are you to recommend our ward to family and friends requiring similar care or treatment. Because obviously in healthcare, not everyone's going to recommend a health facility to their family and friends because they don't want their friends to be sick. It doesn't make sense. So the question was adapted. And this is a common question. And following on from that question, you can have a set of responses that can be quantified. So essentially tick box type responses. And this can vary. So even in the UK, where there's very strict guidance around or regulations around how you ask this question, different hospitals have different options for asking this particular question and how you actually quantify the responses. Now, in Australia, for example, the standard question set is starting to come out called AHPEQS, AHPEQS, around standard questions and how you ask these types of questions. In the US, there's the HCAPS, HCA, HPS question set. The picker questions are used in the UK, and family and friends are used in Europe. And in Malaysia, for example, they use a SEQUAL, SEQUAL. So there are many different questionnaire types being used in different countries around the world. Largely, they're quantitative, but what's very important also is now the growing use of qualitative questions. So that is having these free text fields within your question sets that actually give you some very, very important information. I'll let you guys read that for a second. So what you can see here is some deeper commentary around the root cause for poor scores. And this commentary is really, really important. If you're only doing quantitative questions, that's not good enough. You really need some of this commentary to tell you what some of the root causes is. And this will help you get to the root cause quicker so you can solve it. So if a nurse is rude, or a doctor was unpleasant, or the noise at night was caused by a door rather than the vacuum cleaner, rather than staff talking, this is really important, because it's important to help you engage staff, right? When you want to engage staff around how to solve this problem and improve it, you need to know what the root cause is. And that often comes from these comments. Now, there are other platforms that also collect stories, and other people can collect qualitative feedback through collecting patient stories, to doing interviews. Some organizations do a mystery shopper or a mystery patient. And these are all ways of collecting qualitative. So there's many ways of collecting the qualitative information. But my key point from showing you these two slides is that you've got to have some qualitative element, because it's very important when you feed this back to staff, they can really relate to this often much more than they can relate to the quantitative reports. Okay, so this is a really important point. The next thing is also that when you want to engage staff and translate into outcomes, that you have multiple different channels for collecting feedback. So some organizations are doing web-based feedback, some have been doing paper surveys for a long time, some have evolved into using kiosks or tablets in their wards, their units. Some are doing SMS to patients post-discharge. So what we find is sometimes when you're not getting good feedback through the surveys on kiosks, or patients are disengaged, then it's good to send them SMS or emails post-discharge or after they've left the outpatient clinic, and that gives you higher levels of response rate. Because you do need to build up a certain number of responses to get often your leadership engaged as well, because sometimes they can dismiss individual patient comments and say, oh, well, that was a one-off. You know, we don't really want to, we can't use that single piece of feedback or that single comment as representative of our entire department. Whereas what I've seen, the real patient-centered leaders take every comment seriously, particularly if it's a comment that's about safety, that can cause serious harm, or a patient is complained about being abused by a staff member. That one single comment can be very, very important, and you need to use that one single comment to translate outcomes. So it's not always about getting a larger pool of data, although in terms of system level change, that is important. But if you're trying to change a single ward or unit and implement service recovery and good service behaviors, even single comments can be really important. And you do that by having this kind of multi-channel approach in your organization. The next level is then to get into analyzing that feedback, because as you start to become more advanced in this space and you actually get more and more of that commentary, manually analyzing it is important, and you can do that, and some organizations do that and do that well. But nowadays there are also technologies that can actually analyze the feedback using these keyword clouds, as you see on the left, that can translate into positive, negative. There are other technologies like the Pensensic tool that can actually map the emotions down to anger, frustration, fear, sadness, happiness, and delight. And I'll show you case studies of how that actually is used in practice. But also that granular reporting and getting down to that ward or department level in real time is we are seeing where organizations are going, particularly organizations in Kaiser Permanente, Cleveland Clinic, but also at Western Sydney. Other organizations can actually extract this data in real time and actually also break it down by domains. So these are the domains of patient experience that often PICA use, so staff introductions, kindness and respect, involvement in care is a big domain, cleanliness, noise levels, typically very poor in hospitals. You can have different domains, but you can also break these down by by ward or by unit level, and some really advanced organizations can do it by individual level as well. Obviously the domains are different, but it's really important, and heat maps like this are really useful. Now, why am I going into this in detail? Is because if you want to engage your staff to use the survey feedback and the outcomes, the more granular you get it and the better your reports, and having these kind of traffic lights make it very easier to understand whether they're hitting a benchmark or not, and so they can see it quicker in terms of how their performance is going. Here's another case study where we use the example of Lisa, a facilities manager who has gathered a lot of those free text comments, and she wants to know how she can improve the facilities, because as you know, environment is a big part of the hospital patient experience. The facilities, the walls, the cleanliness, all of that comes into the comfort and the experience. And so using these sort of free text analytics, the theming of the commentary from patients has been done automatically, down to comfort, hygiene, food and beverage, facilities, even down to parking. And that opens up a word cloud, as you can see, which shows, largely people are saying the facilities are good, but then you can see that there's a lot of people commenting on not enough seats. That seems to be predominant. So Lisa, as a kind of facilities manager, then clicks on not enough seats, and that then drills down into the actual comments that have come from the wards. As you can see, it's coming from either orthopedics or liver or pediatric dentistry or so on. And so when Lisa has a very finite amount of time, energy, and budget, she can focus her spend on very specific areas or specific units to improve experience. So we're not spending our time, money, and effort and across, let's paint every single building or let's paint every single ward, and spend all our budget on that, but rather let's really just spend the money and time and effort on where patients are telling us that they're not experiencing good comfort, and because they're not getting enough seats or enough chairs. This is really important when you're trying to translate feedback, survey feedback into outcomes, that you get very, very specific and granular down to this level. And as I said, now there's automated tools that can do this. This is another example here. I'm just conscious of time, of an example of a project down in Western Sydney. We got permission from Krisan Segram and Catherine Maka. This project is called We Got You Back. And it was an example of a clinic, the neurosurgical clinic, where they wanted to look at access to care for adult patients with back pain, and how they actually implement a more cost-effective patient-centered service by August 2008. And they found that there was a real problem in terms of accessing the clinic, because there was a very long waiting time and people with back pain really suffer. And they found that only 1 in 6 patients were able to access the clinic today in a timely manner, but it would draw to 1 in 15 patients would access in a timely manner, i.e. within 12 months, because of the waiting times. So they really tried to look at, cutting down the do not attend rate, the access to the clinics, the referrals, and the triaging as well. And so they really looked at particularly the areas that were problems coming through from the feedback. And patients are saying, look, when I'm being triaged, I'm not getting very good communication, particularly around my appointment time when they were showing up. Some of them were saying I had to wait very long. I didn't even know what was going on. And so we introduced, they introduced this My Experience Matters survey tool, which we provided the real-time patient feedback platform for this, which they branded as My Experience Matters survey. And from that survey, they got very specific feedback from patients in real time around the domains that they were not performing well in that clinic. And they found that the scores around kindness and respect, as well as involvement in care and the quality of communication, was in red. And so the team over there thought we need to focus on that communication piece and find out what's really going on. And when they did that deeper dive or deeper analysis, they started to actually engage patients and ask them questions around this. they found that only 1% of patients actually received the letter of appointment. So the letters were going out, but only 1% of patients were actually receiving them. 24% of patients were not receiving the text message reminder. And, you know, there was a cost to this. $400 was lost per 15-minute appointment. And in terms of the appointments available and the number of referrals, many patients were not showing up because they weren't even receiving the letter of appointment. And this is really comes down to the investigation done by the team. And so they engaged the staff around this problem, and the staff also said, we don't want patients to be waiting in the clinic. So they saw the feedback, they involved the teams in the feedback. We don't want this to happen. Let's figure out some solutions around this. And so they came up with 3 solutions, and one was reallocation of administrative staff to bookings to call patients up and to make that whole process of making sure patients showed up more efficient. They also restructured their clinics so there were more physiotherapy-led clinics, and they also recreated a multidisciplinary interaction through a spinal case conference, which then helped them restructure how they manage the clinics. They measured that feedback over time after introducing these solutions and engaging their staff in developing these solutions, and they found that there was a significant improvement over a 6-month period that was sustained over 3 measurement time points, which is really, really important around communication and involvement in care after doing the restructures. And some specific questions they asked was particularly around communication. The staff explained things in the way that you could understand. You can see that in terms of all of the time, there was a 50% improvement after introducing these solutions in that patient experience. Also, in terms of that key question again, how likely are you to recommend this service? In terms of pre-intervention, that extremely likely was at 29%, but post-intervention, it jumped up to 61%. So you could see that those interventions really not only engaged staff, but actually delivered some outcomes in a key way. They also used the word clouds to look at what patients were saying, what were helpful, and clicking on these keywords actually helped them drill down into those comments around who was saying what was not helpful or unhelpful in this way. And one of the learnings, or several learnings, that they got was that using real-time feedback was really important for them to monitor how their solutions were progressing over time. It gave them an opportunity to evaluate service changes. They got this very important qualitative but also quantitative data, and also having that multi-channel approach, sending SMS or emails to patient or paper surveys that they can do in their home, in the comfort of their home, allowed patients to complete the surveys in their own time. Whilst also they use the iPad mechanism to collect feedback in their clinic as well. So having multiple different sources of collecting feedback allows you to engage not only patients but also staff in different ways, and using that and incorporating that into service delivery was really important. Now here's a really important thing when you're talking about how do you translate survey data into outcomes. It's really, really important for you to understand this hierarchy of going from data to information to knowledge and wisdom. And this is that data hierarchy to see very important. When you do surveys and you ask questions that are yes, no, scoring out of 5 out of 10, agree, disagree, that's data, okay? Now, when you actually start to translate them into reports, that's information. For example, when you get information that only 1% of patients received the letter of appointment, that's information. You then translate that into knowledge, which is how do you actually use knowledge and create actions. And this is where you saw in that particular example, they created physiotherapy-led clinics, multidisciplinary meetings, and so on as solutions. And wisdom is when you actually produce outcomes and you're able to sustain that over time, which in the case of these neurosurgery clinics, they saw that 50% improvement in patient understanding. So data and survey outcomes alone does not equal outcomes. You've got to go through this whole hierarchy of information, of translating data into information and reports that are meaningful. Then that creates actions, right, in how you engage staff. which then ultimately results in wisdom and outcomes. And so most people don't understand the steps that they need to go through in order to create engagement and translate that survey data into outcomes. And we marry this up in that 6E process that I showed you earlier of experience right up to execution and excellence. And this is where the strategy piece comes in. This is where you need a strategy and an improvement methodology to improve experience. And you may have seen many cycles in strategic methodologies like the PDSA cycle or the quality improvement cycle, Lean Six Sigma. I'm very familiar with these. I'm a green belt. I've implemented many of these projects in the past as well, and they're fantastic methodologies, and I strongly encourage you to continue to improve them. But when we come to human-centered design and we want to introduce more humanness to it, you've got to include the patient voice. You've got to include the consumer experience into that, and you've got to get down to the emotional layer of what's frustrating them, what's causing pain, anger, because that's where human-centered design is starting to come into improvement methodology. And that's why these 6 E's incorporates that. Also, when it comes to your KPIs for excellence, which is E5, you have very relevant patient experience methodology. So as I've lightly touched on, the first E is around capturing patient experience. The second E, E2, is around emotion, analyzing stories or comments or that qualitative feedback for pain points and delights, because that's going to create more emotional connection when you want to engage your staff. So when you engage your staff, they are going to be, some of them, or some clinicians particularly, are going to be very, very driven by quantitative measures, and so you're going to have that, but some others are going to be more driven by the stories, the comments, the qualitative aspects. So you've got to have both if you want to translate surveys into outcomes, and that will lead to a change management process. And then that, from there, as you engage staff and you've got them motivated, or clinicians and so on, you've got to give them good strategies, quality improvement methodologies, service recovery methodologies, service culture. That's where the culture piece comes into it. It comes into the engagement and the execution. But culture is also your incentives, your performance metrics. That's also culture. Don't forget that. So you've got to have KPIs or key performance indicators that's relevant to your culture. What are you going to have as a KPI for a good service experience or a good patient experience? Is that embedded? Does your CEO have that in his KPI? Do your frontline staff have that? And as we see, service-oriented or patient-centered organizations have those KPIs right down to frontline staff. And so where are you at in terms of your KPIs at the moment? And this can take a process of years before we get to that point. And you've seen in the US health system, even their financial reimbursement is linked to patient experience KPIs or the HCAP scores. Now, this is happening again. So I'm just going to ask Sharon to actually open up the presentation, and we switch over to here in terms of this issue. And I apologize, PowerPoint seems to be causing this issue. But Sharon, if you can open that up for us, thank you very much. And you can see if we can move to presentation mode, we can see that KPI. So Sharon, if you can move to presentation mode, you can see that then the other piece there is around evolution, which is how do we actually sustain the change over a period of time. So we seem to be having a blank screen, Sarah, and I've got PowerPoint opened up again, so if we can just switch back, that would be great. And so if you can just take a minute to just write down, as we sort of put back, where are you at? Out of all the pieces that I've just shown you, is there one solution or action that you can take, that you need to focus on to engage your staff to translate actions into improvement? So can you just do that and take a minute to do that as I pull up the next case study? So hopefully you can do that. And I've got the next piece up. again, Sharon, so you can switch back to me. But just write down, what's your one action that, that you can take at the moment as well. So as you're doing that, I'm going to pull up the next case study that shows you another organization that's done this, where a group of specialist clinics, and this is the IVF clinics, were actually going through this process of translating survey outcomes into survey feedback into improvement. And they wanted to see, how do we become the provider of choice in patient experience? And so they identified some real clear skills gaps, but also identified that they needed to engage attain more buy-in from staff in terms of improving patient experience. So one of the things they did was actually do a training workshop to train staff on the different elements of patient experience, because their staff actually didn't fully understand all the different aspects of improvement. What are the different ways to improve communication? What are the best practices that other organizations use? And what are some of the solutions that people use for training on empathy, on communication, and so on? And by using this method of using that 6E model or strategy, they managed to actually improve their Net Promoter Score by 15% in 12 months. And they also found that the satisfaction with doctors also improved in that time as well. I apologize for this. So Sharon, if we can try to switch back to you. Apologies for the PowerPoint disruption today. I'm going to quickly skip through. So as Sharon's pulled up, as you can see there, the next piece is around changing culture and energizing that staff experience, which is really one of the big pieces around this. If you can move to the next slide, Sharon. So many of you have asked around this. Now, culture is a function of an organization, but it's also a function of people, and people have emotions. And one of the things that we need to understand when you're trying to change culture is that we all go through this change curve and this emotional change curve. And some people are in anxiety, some people are in denial. This is very, very much that Kubler-Ross change curve or grief curve as well. But as you're trying to change culture and trying to engage your staff or yourself in improving patient experience, you have to understand, where are people at the moment? Are they anxious about bringing on the change or creating improvement? Is there some fear behind making an improvement? Or are some of them at an acceptance phase? Have they started to accept the change that they need to make, that they need to create actions? Are they at realization? Or are they energized as a champion? Or are they growing in this space? And you've also got to understand your change curve as well. Where do you sit in terms of translating feedback into improvement? How engaged are you? Have you got some fear? Have you got some anxiety around driving some of that improvement yourself? This might seem like soft skills, but I can tell you from my experience, the leaders in this space are very, very self-aware around exactly where they personally sit and what they need to energize themselves and grow to become a change champion. If you go to the next slide, Sharon. Whilst at an individual level we're at this phase, organizations are also going through this change curve. Some are actually just learning and becoming aware of the need to measure patient experience. Some have built up a greater understanding. Some are experimenting and adopting different solutions and techniques, whereas some are institutionalizing or embedding or internalizing the change as well. And so we go through these different stages as well. And the question you ask yourself is, where is your organization on this change curve right now? Or where's your department, or where's your clinic on this change curve? Next one, Sharon. So we've developed a very structured methodology for doing this, and this is called the Patient Experience Maturity Evaluation. And there's a set of tools that we've developed to actually map exactly where your organization sits on that change curve by asking you a series of questions and your team around where it sits in terms of its experience, data analytics capability, where you are in terms of engaging staff, and so on. And next slide, Sharon. And this is then mapped into a maturity model which then maps and tells you exactly what stage you're at in terms of the patient experience maturity, which then gives you a very clear understanding of exactly where your organization sits in terms of its capability of changing surveys and feedback into outcomes and what capabilities you need. Next slide, Sharon. Aside from that, it also tells you what actions you need to take through a patient experience action matrix, which is mapped to the stage of the organization as well. This then gives you an action to say whether you need to be doing better survey, having better survey tools, engaging staff in a better way, taking on better feedback, having more roundtables in your organization as an idea for engaging staff, particularly in terms of where they are on that change curve. Next slide, Sharon. Now, here's another case study, and we can just drive through that very quickly, Sharon, is we worked with an organization in a health district where they mapped their maturity and realized that they were actually performing surveys in a very ad hoc manner, but needed to move to a more organized manner and engage staff. So they felt that they needed more granular data in particular, because the survey feedback that they were getting was very much at a hospital level, but not enough at a frontline level. And so they needed to get their leaders at a department and middle management and obtain buy-in. And by moving to more real-time feedback, they managed to also introduce a larger number of quality improvement projects. So after 2 years, they had 32 quality improvement projects underway, improved the governance and accountability within their organization by having a patient experience team that was cross-functional, and over a 2-year period, that won the program of improving patient surveys and feedback, won 2 district quality awards, got nominated as a finalist for the best digital transformation project. They were also starting to change culture by actually introducing the KPI around patient experience at board level, and they also introduced a patient experience superstar award. So the reward and recognition program included the recognition award as well. And the next piece then, and next critical success factor, is around what tools and actions do you take to deliver more value-based outcomes. And as I mentioned earlier, the cost of a smile, it costs you nothing. But if you want to look at more deeper solutions and engage staff and engage culture change, the various ways in which you do that. And I've talked about that some organizations have done training workshops where it's really about upskilling staff. Others, so at Western Sydney, we ran a patient experience roundtable, and we invited staff from other hospitals or champions from other hospitals to come together to brainstorm solutions around patient experience. Some of these are delivered on-site, some are off-site, and some are run through webinars. So even running webinars is important. And I've talked a bit about making sure you have a reward and recognition process that's specific to the metrics that you're measuring, and that you have communication programs or a marketing campaign around these patient experience recognition programs and awards and metrics that is tied in with the survey tools, the feedback, and the data and outcomes. I might skip through this case study in the interest of time, but it's really important to kind of recognize that some of the strategies that we've just talked about are applicable to not just acute care facilities or inpatient and outpatient, but also through primary care, also through specialist care. So you might be organizing radiology and pathology, procedural facilities. I've seen some people from pharmacy, public and private sector units, wards and departments, call center, aged care and community care, as well as disability, are starting to use methodologies like this. We're also starting to see requests from other services like ambulance, auxiliary, mental health, starting to look at a more holistic methodology for taking feedback and measurement. And here's some of how some of the wards and units are collecting and analyzing patient feedback. Now, I know that some people have talked about how do you recruit consumers in terms of how you do this and engage with staff. And that is a real piece on its own. So I won't cover that in detail today, but other than to say that there are processes in place that we can talk about offline, that I'm happy to talk about around how do we engage consumers. We'll run through this very, very quickly, but this is another ED that was looking to engage staff through a redesign process and use the 6E framework to align themselves to quadruple aims. And they did a whole service redesign as their solution and mapped the patient journey in order to translate the feedback into outcomes and help them reduce bed blocks that were occurring in the emergency department as well. And this particular ED director of a private facility was then able to get better outcomes. We do have a community called the Patient Experience Community on LinkedIn that you can join and ask some of your questions as well if we can't answer them at the end of this department. But I'd love to finish off with a final question. What are your top 2 priorities? I think we asked some people around this as well, but if you want to answer whether it's around developing a survey or analyzing the feedback data, or is it engaging frontline staff that's the biggest problem or priority, or is it engaging your CEO and your leaders where you're trying to focus on? Alternatively, is it more around knowing what the right improvement action is, or is it around implementing the right solution? And finally, some of you, is it around sustaining improvement? Please feel free to type that into the chat box as well, so we can focus some additional ideas, because as I said, I'd like to actually give you some real specific feedback that will help you in this one webinar. So hopefully by now you've got at least one action that you need. A couple of you have talked about analyzing feedback data is a real problem for you, and that's really interesting, because I'd like to have a conversation, happy to have a conversation offline with you, whether that's a time constraint, whether that's a knowledge constraint, whether that's a skills constraint, or whether that's a tools constraint that's causing that problem. And for Lynn and so on, it's around engaging leaders and frontline staff, E and G. Anne-Marie talked about E and G and type G a lot of times, which is around sustaining change. So knowing what that right improvement actions is. As I mentioned, we've created that patient experience maturity model, which is mapped to specific actions that have been gathered from lots of research around the world on what are the right solutions that you implement at the right time, which we have specific mentoring programs that we do on that. But also sustaining change, again, the block for sustaining change can be different at different times. Sometimes it might be a leader becomes disengaged, sometimes it could be staff turnover, sometimes it could be not having the right data set to give to staff at the right time. So it could be a number of things, and it's really important that you find out what some of those processes are, but also what are the emotions that people are feeling. And sometimes we have too much change, we have change fatigue, we have too many different initiatives and priorities going on. And my guidance for you to that is pick one. Get your staff, get your leaders or so on to pick one that they're going to focus on, either for the next week, the next month, the next 3 months. Pick one, because we do ask people sometimes to do a lot of things. And if you're finding that the problem is too much change, ask that individual to focus on one specific change at one time. Now, I'm conscious that that you might be having other questions, and we've got 2 minutes to go. We'll skip through this last slide at the moment, which talks about the different stages of maturity, and we'll just finish off with just the question slide, Sharon, because if anyone has questions, please type them into the chat box, and I'm happy to take questions for the last minute. This session will be recorded, and we do have the opportunity for you to click on some more time with us by just emailing us, and either myself or one of my team is happy to have a chat with you, or you can just click on the link which one of my team will put into the chat box right now, so to have a consultation to talk a bit more about that. But I can see that some of the questions being put into the chat box. In one case, and I've seen a couple of hospitals having, for example, electronic medical records implementation being a major point of focus, and that can take up a lot of bandwidth and a lot of capacity in the organization. And you know what? Sometimes you just do one thing really well and engage your staff to do that, because if the electronic medical record is going to improve the patient experience in that, then focus on that and get that piece up and running. You may have others that have gone through that EMR implementation and now want to look at the next thing, then help them with the next thing. But again, people do have a specific bandwidth, a specific time, and we've got to understand that. And the EMR can help patients as well. Someone asked me, what is the LinkedIn group called, Deborah? It's a question from Deborah. It's called the Patient Experience Community. So if you go into LinkedIn and type that into the search box, then and type that in, and Sharon, thank you, Sharon. Sharon helps manage the community. It's called the Patient Experience Community on LinkedIn, and we'll be happy to address more questions there as well. No worries, Deborah, happy to do that. I'm just conscious of time. It is 12 o'clock. We've gone on the hour. I'm happy to stay on for 1 or 2 more minutes, and Charles has put in the LinkedIn group chat. Thank you, Charles. So if you do have further questions, please feel free to either type them in the chat box and also type them into the LinkedIn community, or just email us on some of the contact details below, or schedule a time for a free conversation with one of my team. Would love to just chat with you and loop you into some of the things that we're doing. One of the questions from Lynn was, what is the most cost-effective means to engage staff, example, via social media platforms? Look, that's a really big question, because cost-effective can mean different things to different people, and engaging staff in terms of social media platforms. One of the things I will say is that different hospitals or health organizations have got different protocols for engaging staff via social media, and so they've got policies in place to either use Facebook, Twitter, LinkedIn, and so on, and they've got different permissions in terms of how you can use social media. Example, one of the best that I've seen is Boston Children's Hospital and their social media strategy. And I encourage you to have a look at case studies around Boston Children's Hospital, or please feel free to write to me, and I'll send you some stuff, or might try and run a webinar around this at some point, because they've got a very comprehensive strategy around engaging patients, consumers, and staff around social media, because it works hand in hand, and they've got some very clear policies and guidelines. And I cover some of this in my training sessions on social media and how to use social media effectively to improve patient experience, because it is a whole talk in itself, Lynn, but it's a very, very good question. So I think we've just run a little bit over time. Thank you very much for your attention. Hopefully you have at least one action that you can take away today or tomorrow, and please feel free to contact me or my team. Stay in touch, get on our email list, and look forward to connecting with you again sometime in the future. Hope that was helpful. Thank you very much, guys. Goodbye, and all the best. Live your experience, love your work, and just keep going. Thank you. Goodbye.